Good afternoon. Hello, hello, hello. Hello. Anything? Hello. Hello. Oh, they must start. Louder. It needs to be louder. Don't tell me don't. Good afternoon, everybody. Oh, that's loud.
Hello.
This session is going to be led in English, and I'm aware that we have some French speakers in the audience, so they will bring you some headphones. Could I ask the logistics team at the back to please provide headphones? I will begin nonetheless. Good afternoon. My name is Uradile Moseki. I am from Frontline AIDS. If you were in the room in the previous session, you would have seen more Frontline AIDS staff. So glad that we are present in this room and you are interested to be here with us. This session, apologies for starting late, but we will try and keep our time. The session is on accelerating HIV prevention for key populations. However, we have a challenge, which is that my co-moderator was unable to attend, and some of our speakers were unable to attend as well. However, the show must continue. So I'm going to change the title to Accelerating HIV Prevention for Trans Communities in Africa. And I'm joined here by my good friend and colleague of many years, Sam Ndlovu. Sam is a national of Zimbabwe from Bulawayo. He is the executive director of TREAT, which is a trans-led organization based in Bulawayo and serving the southern region of Zimbabwe. TREAT stands for Trans Research, Education, Advocacy, and Training. So I'd like us to all welcome Sam to the discussion. So Sam has all of this time. And I said he should take his time to shine because as we know, trans communities continue to be left behind in the HIV response. So it's not bad that he has the floor today and he can take up the space. Yes, of course, we wish we could have had our other colleagues here to speak on HIV prevention for people who use drugs and for sex workers. But since they are not here, we will speak on what we know here. So Sam, to begin us off, can you please paint a picture for us that shares why HIV prevention is such an important set of interventions for trans communities, and speaking to your local experience as the ED of TREAT, but also as your chair personship of the Southern African Trans Forum?
Okay, so when you look at the world over in terms of
trans and gender diverse communities. Looking at the issue of prevalence rates, you'll find that there's some data that has shown where the general population, we have 0.7%. This is at a global scale. 2.5 for sex workers, 7.5 for gay men and men who have sex with men, 5% for people who use drugs, and 10.3% for trans persons. And we only really have 4 countries who have disaggregated that data between trans masculine and trans feminine persons. In the life that we live in our communities, we all realize that our sexual networks are never something that is really sure. So that intersection of sexual partners, it integrally means that when there is risk to any particular group, there is risk to us all. So this is something we continuously have to keep in mind, because those are communities that may have problems in terms of accessing adequate services or the interventions that would ensure that we reach our targets holistically. If we do not reach those communities, essentially because those networks are not predefined, then that risk is bared by all. So basically, I will just take you through the life of a transgender person. Being a transgender man myself, there are many areas in which we tend to face various challenges. So the challenges are varied from even the simplest of things in relation to accessing financial services. When one gets to a point where their appearance does not match their basic unit of citizenship, it becomes a challenge to get around things. Unable to, at times, smoothly access crossing of borders, unable at times to get your well-earned money, maybe in specific branches where you are known. And basically, you have to be a known individual and have that visibility for you to be able to have access that is smoothly facilitated by other people. In terms of family life as well, some of the challenges that are faced are quite difficult. We are at a point in our societies where the information on who trans people are is not widely known. We have the problem that the terminology to describe our existence is very much academized language. So when we are within communities, it is easier for people to understand when you explain the traits that you bear, rather than speaking about a set of languaging that is not a local kind of languaging. It's not originated in our context. So that's one major challenge. But I think if in time immemorial, you can have communities who will describe persons who did not align with the bodies that they were born with, persons who did not align with the genders in which they were placed at the time of birth by virtue of the bodies that they were actually born in. And for me, by virtue of even the differences that exist with sex characteristics, we have people who are born with varied sex characteristics. So when we look at the aspect of gender identity as well, I think what is more difficult for people to connect with is the fact that gender identity is something that is formed within a person's mental existence. It's more like, even when we describe depression, depression is not something you see with your eyes. So gender dysphoria is also something you cannot see with your eyes, but it is something that someone constantly lives with. So generally, the challenges that we have with being understood also encompass the fact that many times uh, being transgender is conflated with sexual orientation. Being transgender in and of itself is not about who you are attracted to. It has nothing to do with a person's attraction to the next person. This is something that relates to a person's identity at the level of self, and that disconnect between that person and what is then ascribed to them socially. I often give an example when we do some sensitization trainings, that asking people to say, if tomorrow you woke up with biological components of the opposite sex, what would be your reaction? How would you feel? What would go through your mind? People have described horror, people have described shock, and they've described it in all sorts of ways. So that just as a yardstick to show that this is the lived reality of many trans people on a day-to-day basis, where they cannot come to terms with that, the body within which they are living. So basically, it's there are various challenges in relation to how we navigate social life and the various layers of exclusion that we tend to face, even within family life. If you are seen born in a particular as a boy, for instance, and then now you are seen in the same neighborhood as a woman, obviously the challenges that are there are vast, because people cannot come to terms with your existence in that sort of way. It's not something widely spoken about, but definitely trans and gender diverse people have existed for time immemorial. Yeah.
Thank you so much, Sam. And I think it is important that when I asked you that question, I went straight to talking about HIV prevention and health. But we've always spoken about the need to see the person in their whole existence, their whole reality. So before we continue, I just want to maybe help us illustrate a little bit more about what impact that this is having, though, on their access to HIV services generally and HIV prevention particularly. Thank you.
Okay, I think the impact that it has in terms of access to services, firstly, it's the gendered nature of the services that we are receiving. So, your HIV related prevention materials, the way in which the education is taught, it's very much assumptive. I'll give the example of, for myself, as a trans man, all through my teenage years up until the point of my youth, I never really knew or had knowledge around the usage of condoms. And for me, being a transgender man, the obvious assumption is that my sexual partners would be cisgender women. Whereas, as I said before, it has nothing to do with my attraction. So when my attraction is to other men, in terms of safe sex barriers, I have that challenge in that there is no particular set of education that is set to help me be able to negotiate condom use much better, especially in relation to penetrative sex. Also, there's other services that tend to come with that package, such as when you look at cervical cancer screening, and in the case of trans women, at times also prostate screening. So anything that is gendered in a way that causes dysphoria becomes difficult for you to be able to access. So just the nature of that service, many people often choose to go without that service, mainly for the fact that the trauma that is tied to the way in which it is gendered, and how it escalates what we call gender dysphoria. I think the other issue also relates to, we do not have gender affirming healthcare services in many of, I think, our countries within our region. As yet, I'll say as yet because I'm very hopeful. I believe the holistic nature of our services is a negotiated space in which we sit together with our elders, our leadership within the region, and we build solutions that work for our context and our region from an African lens that is not antagonistic, but rather negotiates space for each of the communities. So basically, the even issues of taking art or prep, sometimes people negotiate between the hormones that they are taking and taking whether it's prep for prevention or art, um, and that adherence is largely affected by people's perception of them not being able then to actualize and have and take hormonal therapy for them to then alleviate this gender dysphoria that they live with on a day to day. So it becomes a situation of prioritizing. And most times you'll find that a lot of transgender people will prioritize their hormonal therapy. I'll put it just plainly, one of my biggest fears is being buried. I often imagine myself being buried in a body that all through my life I did not recognize. So that tension for me, I understand when my fellow colleagues and other trans persons, they make that decision to question whether or not to adequately protect themselves or balance it with being able then to attain that comfortability to be able to navigate day-to-day life.
Wow, that's amazing. Thank you. That really does bring to the fore a lot of things that are often not spoken about, the complexities of trans communities, beyond what we already know around stigma and discrimination and avoidance of health services because of how you present. Um, would you like to just elaborate a little bit? You had begun to speak about local, indigenous strategies and tactics in working with leadership and the HIV response, for instance, in Zimbabwe. What are the sorts of kind of creative strategies that you've used as TREAT to ensure, impactful interventions for trans communities?
Okay, so if there's one thing that I can say, I know within our context, it's important to understand that as African people, we have grown up in a setting where talk around sex and sexuality has always been something that is not very much openly visibilized, and it's something that has not been a topic to, for lack of a better word, I think remembering from church, one word we used to use to describe a state of things being calm without a sense of reverence in how you handle the topic. So I think some of the work that we have been doing has been to try and integrate those structures of how we communicate within the African setting in terms of how we relate to communities, who we are. We work, especially we've had the opportunity of having our National AIDS Council facilitate those conversations, even if we as the communities take the lead in terms of getting that knowledge out there. Firstly, for people to understand the pathology of being trans itself, as is stated currently in the ICD-11, the International Classification of Diseases document by the World Health Organizations. So getting that understanding in terms of the diagnosis that exists around being trans, the lived reality itself and the experiences, um, their interventions around experiences of violence in and of itself, And I think working also with other clinical partners such as Population Solutions for Health, uh, there has been a way in which our services, at least spaces that have started to speak to the design of the services that trans and gender diverse persons can start to access and continue to be on that drive to encourage good health seeking behavior in order for us to get to a point where holistically we can say that communities have been reached in terms of the HIV response. So I think we are very, the likes of UNDP with our National AIDS Council have really facilitated spaces for us to have conversations where previously you would never have seen yourself sitting down and having that conversation about what it is to be a trans and a gender diverse person, the challenges you face. And I guess in a way, it slowly starts to draw you back into feeling like an adequate citizen of the the place where the universe has placed you to exist and belong to. So just having that audience, and I know it's a difficult topic for people to understand, but being able to be seen firstly as a human being, regardless of where people's opinions lie at a particular point in time, but being able to put human face and then also being able to speak to what that means in an African context. I think many a time with many interventions, what tends to happen is we often start to superimpose um, ways of working or getting messages across that are perhaps used in the global north. Whereas in many times those do not work for our context. So we really need to start to speak from the lens of how do we get across our messaging within our own settings. I think also with that, I'm reminded of different processes we've taken part of, including just generally like target setting, for instance. They are generalized figures that are set based on perhaps the first places where those studies have been conducted. And with a lot of academic knowledge, you'll find that those settings are not where we currently sit. They're not within a country in the southern region of Africa. So they can be flawed and skewed use of different methodologies if we do not localize and create the kind of knowledge around the different communities that can give us adequate data that is relevant to where we sit, but also can more adequately cater for the communities and their needs specific to where their context, where they currently live in their localities. I'll tell you, most trans and gender diverse people in our setting do not even know that they are referred to as trans and gender. Think of a rural trans and gender diverse person. They do not carry that language. It does not speak anything to them. I, for one, for a long time, did not exactly use that terminology for myself because in many instances it was spoken of in relation to psychosis. So I do not want to be seen as someone who uh, basically is a sufferer of psychosis. So it took me some time to understand and learn what this means and what it actually translates to in my own personal lived reality, which is what then gave me the opportunity to come to a time when I identified as such.
Thank you so much for that. Would you like to just continue? So you've spoken now about localizing and ensuring familiarity of the lived experience using our own languages, right? So to overcome that confusion, right? instead of trying to translate it from somebody else's language, whether it's English or another language that is not your own, is how you find the existence of that experience in our own language, in our own culture, right? So that's really great. Could you share a few other, to close us off, a few other recommendations for the future of what you would like to see happen going forward?
Yeah, I think the issue of data for me is, and knowledge creation is close to the heart. I think we definitely need to create more knowledge creation and data around our communities. When I look on a search engine in terms of information about who I am, I do not want to only be faced with information and data from another context. I want something that I can relate to, that is relevant to my lived reality within Southern Africa. Then there are many assumptions as well, also around trans masculine persons. So I believe with the previous IBBS study, this was when I think it was a matter of an accidental coming across transgender persons, which then led to a point where in the national AIDS strategies, there was inclusion of a response to transgender persons. But within that scope, because it was a study on men who have sex with men and gay and bisexual men, it unearthed, by virtue of, I guess, biology, it unearthed trans women, but did not speak holistically to transgender persons as a whole. So recently, I've been working with a trans masculine working group that has put together a policy in relation to the inclusion of trans men and trans masculine persons within the HIV response. This is because one thing's for sure, in terms of transgender data, you'll find that very few countries actually disaggregate by trans feminine and trans masculine and other gender diverse persons, of which I think Nigeria is one of the countries that has done that with them basically showing the discrepancy in their data between trans women and trans women or trans feminine persons and trans masculine persons was a mere 0.2%. So they had a figure of their art figure of 19.6, and for trans men it was around 17.2, which was not much of a difference in terms of if we're looking at the vulnerabilities that both of these groups have. Trans masculine persons, you have some who also intersect with being in transactional sex, because within our setting, once someone is within a masculine identity, there's the social pressure in terms of them being a provider. So many secretly go into transactional sex. There are some who generally are attracted to men. And there's a lot of assumption around seeing trans men as lesbians, which is not true. So I think a lot of data, especially I think my recommendations around data are quite, are my most key takeaways. But also when we look at the issue of gender-based violence, I think gender-based violence amongst trans communities is one of, because of the assumptions, and we spoke of the issues of criminalization within our settings. People fear to seek recourse when they are, at times it's assumptive that they will not get the help, but people fear by basic virtue of how the societal stigma and discrimination for these communities. So gender-based violence is a factor that actually it exacerbates the, the opportunity for someone's vulnerability to HIV infection, or being unable to ensure that they are healthy enough for us to get to a point of undetected HIV for persons. So I think it's a combination of things. We need to find ways as well in terms of family integration, mitigating that violence by ensuring adequate support structures for trans and gender diverse persons within their support network. I think in cases where we've managed to integrate people with their families, even their quality of life, even their issue of behavioral issues, issues of high drug and alcohol intake have been mitigated by someone then having that sense of belonging with their family. And as their family journeys to trying to get to understand their sibling, their child, their family member better, but within a setting that is of support. All these directly link to how a person can have a better mental health, but a holistic approach to us being able to ensure that the gains that have been made in terms of the HIV response are protected, um, and we keep them there and not see a decline in terms of what we've already achieved as various nations within the region.
Thank you very much. Can we give Sam a round of applause? So I know we are 1 minute left, but I would just like to ask for us maybe to take a few minutes from the next session, if that's okay, to maybe just have 1 or 2 questions or comments to close us off. Are there any questions or comments for Sam? Yes, Anu? Mike is not working.
And I think we should have HIV integrated services with the gender affirming care should be one of the recommendation. And also mental health should be one of the important services should be provided to trans people. So that's all. Thanks.
Are there any other questions or comments, additions? Going once, going twice. Okay, that ends our session. Thank you so much for joining us and sharing your personal experience and expertise, Sam. Have a good afternoon, everyone.